Teşekkür ederim bu saatte burada olduğunuz.
Thank you very much for being here at this late hour of the day. I'd like to thank the chairperson.
Benim konum ayaktan tedavide mevcut zorluklar.
I'm going to talk about the current challenges and problems in the outpatient clinics. So, I'm going to talk about the prevention methods if time allows me. Of course, about the outpatient clinics, maybe in the other branches, other fields, the problems are overcome or eliminated before psychiatry. But in psychiatry, the problems in outpatient clinics emerged as a result of the pressure from the inpatient clinics. Therefore, the outpatient clinics are started to be established. The first outpatient clinic in psychiatry was in 18th century in Bethlehem Hospital. It's in the UK, and it was used as a depot hospital. In 1917, John Porter Phillips suggested that outpatient clinics should be established for those who were coming back from the First World War. Of course, it is a very huge event, and it's very natural that PTSDs were seen. And inpatient clinics would not be sufficient, and outpatient clinics would be needed, of course. So this was envisaged. Therefore, outpatient clinics were recommended to be established. In 1950s, the antipsychotic effects of chlorpromazine were discovered, and it was a revolution in psychopharmacology, and it was also a milestone in the outpatient psychiatric clinics. Here you can see a view from the Bethlehem Hospital, and there are hundreds of these images, also from Turkey. The discovery of chlorpromazine and other antipsychotics led to the closing down of the depot hospitals for the mental disorders. As a result, psychiatry is accepted as a separate field of medicine, and outpatient clinics are started to be established. Together with the widespread use of antipsychotics, depending on the years, the outpatient clinics are decreased in number, actually. Excuse me, the inpatient clinics are reduced in number. In a study conducted by Young and his colleagues, in 1 year time, 31% of the patients withdrew from the study, and this rate reached 50% in 2 years. So as the treatment prolongs, we can say that the adherence to therapy is decreasing. Another study is from Sweden. It shows that only 55% of the depression patients are complying with the treatment only for 6 months. Therefore, these are the problems in the outpatient therapies. We can say that these treatments are neglected to a great extent. FDA prolonged the blood sample follow-ups from 1 week to 2 weeks for clozapine treatment, and it increased the incompliance rate by 10%. Therefore, it caused the increase of incompliance with the treatment by 10%. Of course, maybe for psychiatric diseases, the appointments less frequent than 1 week is bringing about some problems. But it is also not possible to have more frequent appointments in practice. For the first appointment, maybe we can give an appointment after 1 week, but later on we are talking about intervals of 1 month or 2 months or 3 months. But the studies show that this is not correct. In fact, we say that there is a correlation between the outpatient therapies, outpatient treatments, and the incompliance with the therapy. And after some time, the quality of life of the patients is decreasing. According to a study conducted by Nelson and his colleagues on 3,100 psychiatry patients, we can say that those who do not show up in their appointments have the possibility of hospitalization fourfold than the others, than those who show up in their appointments. And also, 28% of the psychiatry cases who committed suicide have actually dropped out from the therapy, and 24% of these cases commit suicide 1 month after their discharge, even before showing up in their first appointment. So most of the time, if the person is hospitalized and then discharged, the first appointment should be no longer than 1 week or 10 days. Of course, if there is compliance with the medical therapy, there will be less symptoms and complications can be prevented. And close follow-up is very important here. Therefore, there should be a nice development of the relationship between the physician and the patient. You have 3 minutes, sir. There are some factors for the in compliance with the outpatient therapies. We have low socioeconomic status, difficulties in reaching the appointment place, and when we ask the patient about the reasons, they say the patients just forget about the appointment, or they do not feel themselves good, or they just fell asleep. And also the family environment sometimes can negatively affect the prognosis, and also if the family is having a bad mood, poor mood, then it is affecting the treatment negatively. In the elderly, the outpatient treatment is more complied. However, in cognitively impaired patients, it is less. The severity of the symptom is very important. When we look at the schizophrenic patients who do not show up in their appointments, they have more severe disease symptoms. Their functionality level is worse, and they also have more use of the substances. And also the depression and anxiety in disorder cases. If they have mild symptoms, then they also do not comply with the treatment and they do not show up in the appointments. The severity of the symptoms is something that is affecting the incompliance with the treatment. This is a study, a review actually, analyzing about 100 studies, and we can say that the markers about the incompliance with the treatment, we have the lack of insight, male gender, substance use, unemployment, and low social functionality. When we look at the factors depending on the patient, if there are some personality disorders or substance use concomitantly seen together with the psychiatric disorder, then they are more withdrawing from the treatment, and they have higher incompliance with the treatment. And if there are comorbidities, again, the patients are less compliant. There are also some factors depending on the clinicians and the physicians. Particularly, there are some physicians who are not psychiatrists, but they are following the psychiatric patients. Could you please sum up? And also, we can say that the patients who are followed by a physician who is not psychiatrist are dropping out from the therapy with a higher rate. And also at the beginning of the treatment and about the disease, the patient is not well informed. And also the patient does not feel very related and connected to the treatment, and he is not satisfied. Therefore, it is distorting the compliance with the treatment. And when we look at the potential side effects of clozapine, about the side effects of this drug, according to a study, we can say that many of the patients do not know about the side effects, serious side effects of the clozapine. So also the physicians do not spare enough time for the explanation of the side effects to the patient. Can I talk about the factors increasing compliance to the treatment? Very fast, please. There can be some practices about in the first appointment after discharge. The appointment should be given as soon as possible, and particularly when you are giving the appointment, the open-ended dates appointments should be given. The importance of follow-up should be explained to the patient, and also according to the patient's status, the hour should be identified. We should not determine that according to our own schedule, but the patient's conditions should be taken into account. And also, one day before the appointment, the patient should be warned or informed about the appointment. And also, for the other follow-up appointments, there should be some flexible dates for the appointment, but of course it is important to give the shortest date, the soonest date possible. And also the participation of the patient should be ensured. The patient should be contacted via phone if the patient does not show up in the appointment. And the reasons behind that should be investigated. And the patient should be assessed in terms of his willingness for the treatment. And also the patient should be analyzed without any prejudices, and a new appointment should be given absolutely. In our country, we have some problems, some challenges. Well, in fact, the rates about working on the basis of appointments are quite low. And maybe there can be a recommendation for this. And also, there should be a notice to the patients before the appointment. There should be a strategy for the patients who do not show up in the appointments. And there should be enough time allocated for the patient for the interview. And for instance, there can be the change of the physician. And when the patient comes and cannot find the same doctor, the same physician, it is very disappointing for the patient. In fact, it's a great problem that the patients are dissatisfied with the service provided by the physician, and there are some other problems in our country. Thank you very much, and maybe during the discussion session, we may talk about the problems later on in our country. Thank you very much. The next speaker.